This video highlights findings from the study titled Intensive Adverse Drug Reaction Monitoring Program Improves Detection of Phenytoin-Induced Adverse Drug Reactions. Phenytoin is widely used in hospitals, but adverse drug reactions may be under-recognized. Some are rare and potentially life-threatening, such as severe cutaneous adverse reactions, or SCARs. For hospitals, the challenge is to have the systems that help clinicians and patients identify early warning signs and communicate quickly when symptoms appear. To address this, the study compared outcomes of routine versus intensive adverse drug reaction monitoring among adult inpatients newly treated with phenytoin and evaluated factors associated with SCARs. A retrospective cohort was conducted at a general hospital in northern Thailand. Electronic medical records were used to identify phenytoin-naive adult admissions with phenytoin medication orders between October 2018 and May 2021. Patients were consecutively enrolled into two ward-based monitoring models: routine ADR monitoring and intensive ADR monitoring, with 500 patients in each group. All participants received standard counseling on phenytoin dosing and administration. The key difference was the monitoring model. In the routine monitoring group, adverse reactions were assessed during routine follow-up visits. In the intensive monitoring group, patients received additional, individualized instruction focused on how to recognize adverse reactions, and they were given access to a direct pharmacist contact to report suspected reactions. The study found that the intensive ADR monitoring program was associated with significantly higher detection of phenytoin-induced adverse drug reactions. Patient-initiated reporting of suspected ADR was much higher in the intensive ADR monitoring group, indicating stronger engagement when patients receive targeted instruction and a direct reporting channel. They are substantially more likely to report symptoms rather than waiting for scheduled follow-up. In addition, the intensive monitoring group documented more SCARs than the routine monitoring group. The multivariable logistic regression showed that SCARs were associated with the presence of comorbidities, concomitant omeprazole use, and older age. These findings highlight that SCAR risk is not only related to monitoring intensity, but also to patient complexity and concurrent medications, reinforcing the importance of medication review and close follow-up in vulnerable patients. In conclusion, this study indicates that an intensive ADR monitoring facilitates earlier detection and reporting of phenytoin-associated ADRs, including SCARs. Comorbidities, concomitant omeprazole use, and older age were associated with SCARs.